welcome to Name That Disease. I'm your host, Jenni. Let's introduce our teams for the night. Our first team of the night are the contorted contusions. Our second team of the night is Team Substantia Nigra. Our winner tonight will win this wonderful anatomy set. Calcium supplement, estrogen replacement, and bisphosphonate can all help treat a disease. Name that disease. A. Multiple sclerosis. B. Lupus. C. Osteoporosis. Or D. Fibrous dysplasia. Yes. Team Substantia Nigra.
The answer is C. Osteoporosis.
Yes, the answer is osteoporosis. That's because calcitonin is a calcium supplement that helps build new bone by inhibiting the bone-resorbing activity of osteoclasts and promotes bone formation by osteoblasts. An estrogen mimic replaces the loss of natural estrogen in the body by increasing the rate of bone resorption. Bisphosphonates bind to the hydroxyapatite surface of the bone and inhibit osteoclasts from adhering to bone to prevent resorption.
Yes, that is correct. Before mechanical ventilation was invented, the iron lung was used to treat this disease. Name that disease. Is it A. Meningitis, B. Polio, C. MS, or D. Cauda equina syndrome? Yes, the contorted contusions.
The answer is B. Polio. Polio is a contagious virus that destroys motor neurons. In 1 to 3% of cases, the virus enters the central nervous system and the medulla, affecting respiration by destroying respiratory motor neurons. This causes infected individuals to have trouble breathing on their own. The iron lung is a negative pressure ventilator machine that was used in the 1950s to help infected individuals breathe. However, because the iron lung was so restrictive, it has been replaced by the mechanical ventilation, which is less restrictive and is a positive pressure ventilator system.
That is absolutely right. All right, next question. This disease requires fast-soluble antibiotics to cross the blood-brain barrier. Name that disease. Is it A. Rabies, B. Meningitis, C. The flu, or D. Strep throat? Yes, Team Substantia Nigra.
The answer is meningitis.
Meningitis is an inflammation of the meninges of the brain and/or spinal cord, caused by bacterial, viral, or fungal infection. Treatment of meningitis must include antibiotics that are lipid-soluble in order to be able to cross the blood-brain barrier, which serves as an impermeable wall to the passage of polar molecules into and out of the brain.
Great explanation. This affects the neuromuscular junction by amplifying the chemical signal from the nerve to the muscle, causing the muscle to tighten up and create a spasm. Name that disease. Is it A. Tetanus, B. Pertussis, C. Rickets, or D. Rabies? Yes, the contorted contusions.
The answer is tetanus.
Tetanus is caused by the bacteria Clostridium tetani and is transmitted through puncture wounds from things like rusty nails or through insect bites. It causes continuous muscle contractions throughout the body, and very often it's fatal.
Yes, that's correct. Oh, time's up. We have a tie. Time for the sudden death physical challenge. Let's bring up one contestant from each team to compete in the physical challenge. We have our volunteers. This is the Rusty Nail Challenge because an accident would put them all at risk for tetanus, and we all know a tetanus shot is a necessary precaution when working around sharp objects leading to puncture wounds. Next, we ask the contestants to label one country on the map that has not eradicated the polio virus. Finally, a milk chugging contest because we all know milk provides calcium to help support healthy bone growth.
Pakistan.
Correct.
In your face.
Incorrect. Well, what a great performance from both competitors. And our winner today is Team Substantia Niagara. Woo!